I'm Dennis Bragg in Hamilton, where Ravalli County authorities are discussing the next steps in managing vaccinations and vaccine supplies in the Bitterroot. Ravalli County continues to vaccinate Bitterroot residents and especially older people at a steady clip, but there are still some challenges when it comes to the duplication of names from people that signed up several times to get shots.
So many people applied and then got shot somewhere else when it all opened up. So now when we're calling, a lot of times people have already gotten a vaccine somewhere else, or we already vaccinated them and they had just signed up 7 different times. So
you may have heard that Ravalli County has an oversupply of vaccine. Weber tells me that's not really the case, and she also points out that pool of vaccine is available not just to the county, but to the community as a whole.
That comes into the county as a whole. It doesn't just belong to public health. It belongs to the county and all of those enrolled providers. And so we're all dipping into that and taking vaccine.
Weber does say it can be a challenge some weeks to use an entire tray of vaccine, which can contain more than 1,000 doses. And a few times the county has decided to share with other Montana communities that might be short.
It's better for us to pass on a tray and see if there are other people around the state that need it more than we do, than for us to sit on it, was the thinking. And so somehow that got misconstrued as to we have all these doses and we're turning vaccine away and people are still waiting. No, we're just trying to be smart about where things are going and not sit on vaccine.
Outside of vaccine, Weber also tells me an additional challenge is just having enough qualified people to administer shots.
And we're getting a lot of retired nurses in, and God bless their hearts for coming and help us. But, they don't have 40 hours or 80 hours a week in them. And I think we're just starting to see a little bit of that COVID fatigue in our healthcare people, where they're just like, I'm 5 days a week giving shots and then mass clinics on Saturdays. And it's getting harder and harder.
In Hamilton, Dennis Bragg, MTN News.